Hi everyone, this is Neil Reiteter, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral, fully occluding earwax. They weren't aware that their right ear, which is the ear that you're seeing on screen, was actually blocked full of wax. And that's because their left ear was far worse. And that was the ear that they attended seeking assistance with. Now, when the patient attended, I actually performed microsuction and endoscopic ear clearance in their left ear first, but for the purposes of this video, I'm just going to show you their right ear first because it was a bit more straightforward, and then we can concentrate and discuss their left ear in more detail. So the plug of wax in this right ear was quite dark, it was quite dry, had a few skin adhesions, so I've just inserted some medical grade olive oil spray. And what the olive oil spray does, well, it does several things. It helps to lubricate the ear canal walls, so it reduces friction, which facilitates the extraction of the plug. Sometimes with wax, not so much in this case, but if the wax is quite sticky and glutinous, it can block the inside of the suction probe. So the oil helps to lubricate the inside of the suction probe. So it helps to limit or reduce blockages. And again, if you've got really soft, mushy, glutinous wax, the olive oil helps to bind the wax together so it comes out in a more larger piece as opposed to breaking off into little segments. So it has got many advantages. Now, olive oil, because it's naturally acidic and our ears produce oils anyway, it's far safer to use medical grade olive oil than other type of drops that are on the market, such as sodium bicarbonate, which is a water-based drops, or hydrogen peroxide or urea hydrogen peroxide. And those drops are a bit more alkaline. The only time I'd really recommend a patient deviating from using medical grade olive oil spray is if they've got a condition called keratosis obturans, which is an accumulation of dead skin which eventually forms into a plug and it occludes the whole ear canal. And I find sodium bicarbonate is more effective at breaking up dead skin layers compared to olive oil. So olive oil is more of a softening agent, where sodium bicarbonate, it doesn't dissolve wax, but it helps to break up dead skin. So it's the only time I'll really advise patients to use anything other than olive oil spray. Now, this is their left ear, and I'll give you a bit of a case history. 3 weeks prior to attending, they first experienced some blockage in their left ear. They then developed a cold, which worsened their symptoms. They then went on a flight to their holidays, and upon descending upon the aircraft, their symptoms worsened once more. And it was when they went swimming whilst on holiday and they got water in this ear, the left ear in particular, that they could no longer hear at all. In an attempt to remove the wax themselves, they've been using loads of drops in this ear. You wouldn't have thought, but you will see it in a moment. When I remove this plug, this patient's ear is really damp and wet. And a week after they returned, they then developed olchalgia, which is a medical term given for ear pain, some tinnitus. So tinnitus is a sound that originates with inside the ear or inside the head. So it's not a sound that you're hearing from an external source. Most people describe tinnitus as a ringing or buzzing, but it can literally be any sound. And they just felt the ear to be really, really tender. So this plug, as you can see, it's slowly but surely coming out. You can see that dead skin layer on the right surface of the wax, that white peripheral sheet of skin. And as you can see, this patient's ear is really damp, it's really wet, it's slightly inflamed, and so they have got a bit of swimmer's ear, so the water's not helped. You can see the ear from a distance. So what we're going to try and do now is just mop up as much of this debris as possible. Now, I'm bracing myself for all the hate mail I'm going to receive because there is going to be some residual wax coating the canal wall, so I can't avoid that. We're going to remove as much as possible, but this patient's symptoms is completely alleviated. And again, I'm going to discuss it in a bit more detail during the next 12 or so minutes, but I actually saw a family member of this patient when I was doing my weekly shop at the local supermarket, and they came up to me and says, "Oh, you did great, great with," there was their sister, and they were really pleased and they were very grateful. But I did recommend several things for this patient after treating them. So swimmer's ear is when water can lead to an outer ear infection or inflammation called otitis externa. Water contains bacteria, and some of the bacteria are quite harmful. Pseudomonas aeruginosa, I think that's how you pronounce it. That in particular is quite a harmful strain of bacteria in the ear. And your ear is the perfect incubator of bacteria, fungi, and viruses. It's warm, it's dark, and if you get water in there, it's also moist. And if you've been watching my channel, I kind of more or less discuss it in every single video, but I hate, and I'm so much against water getting into the ear because it can just lead to an infection. Now, you could get 100 people and everyone gets their water in out of those 100 people, and only possibly 2 to 5%, which is still quite a high number, can develop an ear infection. But we can't predict which patients are and which patients are not. And once you've got swimmer's ear, it can be quite nasty. It can develop into something a bit more serious in patients who are immunocompromised, diabetic, elderly. So not only is water a good medium for bacteria and fungi, but what the water does, if it's logged in the ear like it is in this patient, the skin that lines the ear canal, it's hydrophilic, it absorbs water, which then causes the skin cells to expand, to swell, and then eventually burst at the membrane. Think about a water balloon. It's only so much water it can take before it bursts, and it's exactly what happens with the skin cells. The skin cells rupture, and that epidermis layer, that outer layer of skin, is then breached, which then exposes, if it's the inner 2/3 of the ear canal, the bony part, the bone directly, or if it's the outer third of the ear canal, the cartilaginous portion, where you've got the dermis layer, so it exposes the under layers of the epidermis. So that epidermis skin is a protective barrier. So water can cause a maceration of the skin. In addition, all of our ears, or most of our ears, and even if someone examines your ear and it looks completely clear, we've got this thin veneer of earwax. So dead skin, sebum, and also an oily sweat, the same sweat that we also secrete under our armpits. And this thin veneer of wax and oils, it sits on the surface of the ear canal and the eardrum, and it provides a protective barrier. It repels water, but it also helps the underlying skin that it's sitting on to retain its moisture. Without that oil, that layer of wax lining the ear canal and eardrum, the underlying skin, the moisture rises to the surface and it evaporates, and we get dry, crackly skin. So if you get warm water in particular in your ear, it can wash away those natural oils. They're called essential moisturizing factors, EMFs. And so when that outer layer of skin becomes dry and crackly, again, it's a perfect environment for bacteria to invade and colonize and infect the ear. So please, if at all avoidable, avoid water getting to the ear. Now, I know it's difficult sometimes, especially on holiday. You can get swim plugs. I know people don't like wearing them. You can get custom ones. You can get over-the-counter ones. In fact, I had a client today who's just got some swim plugs of myself because they just suffer from chronic fungi, otomycosis, so fungal infections. If you do get water in your ear, there's several things that you can do. You can use a hairdryer from a distance. Obviously, don't put it on too high power. If you've got temperature control on it, kind of have it at room temperature, because if you have it too high a temperature or too low a temperature, it can elicit the caloric effect, and you can get dizzy short term and also even potentially sick and nauseous. You can use 1 part rubbing alcohol, 1 part acetic acid, and what that formula does, the rubbing alcohol, it homogenizes with excess water, and so it binds together. And alcohol has a much lower evaporation temperature than water, hence why when we use rubbing alcohol, as you all know, our hands get dry. So it helps to dry up the ear. Can sometimes over dry the ear, that's the slight problem with it. And then the white vinegar, acetic acid, helps to re-acidify the ear, because when you wash away those natural oils, also it washes away the natural acidity from the ear. So there's a product that we sell on our website. The URL's there at the bottom right. It's only when you ship to the UK. If you visit our public online shop, there's a product called Clear Relief. Now, that contains, instead of alcohol, rubbing alcohol, it contains glycerol. And glycerol is actually an oily substance, but it also can homogenize with water, so it absorbs excess water in the air, but it doesn't evaporate. Instead, that glycerol, when it combines with water, it coats the ear canal. So in some ways that can be really effective, because not only does it absorb excess moisture, but it also prevents over drying of the ear. And it also contains lidocaine, which is a topical anesthetic, so you're more than welcome to try that. There are things that you can do pre-getting into the water as well. So there's products, or even simple medical grade olive oil spray prior to getting into the water. That will provide a waterproof membrane in the ear, so it just provides some added protection. And again, if you do get water in your ear, acetic acid is a good thing, because it helps to reintroduce the acids that are really important. Now, I've cleaned most of this ear. I'm just trying to get away some of this excess skin at the entrance. It's a bit crusty. Patient could hear really, really well at this stage, so they were very grateful. But you can see there's residues there. It's nothing much more I can do. I'm not going to wash out this patient's ear with water. That's just going to cause more problems. This patient's ear is already slightly tender, inflamed. They've got a bit of swimmer's ear. The best way I can describe it, imagine you're having a colonoscopy, and you have to have your bowels, or if you're having some sort of surgery, you need your bowels cleared before, and so the surgeon can see. You don't then want the surgeon to go into your bowels and scrape off every speck of feces, whatever may be in there, because you're going to cause irritation to the bowels. You may actually perforate it. So it may not look sparkling clean, but this patient can hear, and that's the main thing. And everything else is going to dry. You can see the back part of the ear canal slightly swollen there. So we're not going to, everything I can get away, I will try. But and I showed the patient afterwards, and I think this is where you need to have confidence in what you do. At first, I would really worry about what people online say, patients even, because sometimes you show the video back, patients are not happy that there's a bit of staining here and there, and I have to explain that what we've done is already quite tricky. You can see we're removing dead skin here. It's very less than 0.1 millimeters in thickness, and I don't want to cause any trauma to them. So it's taken me a bit of a while, especially online on YouTube with all the comments you get. So you can see I'm just using the fine end. I've put some oil in here as well, just to moisturize the skin and just introduce some more acidity, and also to loosen some of this dead skin to see if I can peel it away. And I think they were using one of the drops I made reference to earlier, which can also damage the outer layer of skin. So again, sodium bicarbonate drops, they're water-based. The way sodium bicarbonate drops work, when they enter the ear, they react with a carboxylic acid, which is released by bacteria that feed on sebum, which is secreted by the sebaceous glands, one of the oils. And it converts sodium bicarbonate into water and also into carbon dioxide. And when it changes from a liquid to a gas, you get effervescence, you get bubbling, mechanical bubbling, and that bubbling helps to break up the skin. But the skin is quite important. It's sitting on the surface of the ear canal. So that outer layer of skin, it's just broken down by the use of the excessive drops. And because they're alkaline drops as well, it changes the pH of the ear, which just makes it more susceptible for this patient developing a full-blown infection. So what we've done, I've recommended some acetic acid spray. I've written to the GP as well, just in case they need some prescription medication, because they have got a bit of inflammation as well. They also, right at the beginning, I mentioned that this patient felt their symptoms worsened when they were flying and descending on a plane. So I performed a test called tympanometry, which is a pressure test in the ear, and it measures various things. It measures the middle ear pressure, the middle ear compliance, so how well your middle ear is absorbing sound, and also the ear canal volume, so we can see if there's a hole in the eardrum potentially. And it came back with a type C tympanogram, which basically means they've got negative middle ear pressure. The middle ear is vibrating, it's allowing sound to enter, but only at a negative middle ear pressure. And that's consistent with a condition called eustachian tube dysfunction. So behind the eardrum, we have the middle ear. The middle ear should be air-filled, and the air pressure in the middle ear should be equivalent to the air pressure in the atmosphere, or similar. When you've got equal air pressure either side of the eardrum, that's when the eardrum is most mobile. But when that eustachian tube, it connects the middle ear to the back of the nose, the nasopharynx, when that eustachian tube is blocked, so if you've got a cold, which is patient reported, it doesn't allow air to enter the middle ear, so all the remaining air in the middle ear gets absorbed by all the cells lining the middle ear, which then creates a vacuum effect, and your eardrum gets sucked in, and that's when people feel like performing the Valsalva. You close your mouth, pinch your nose and blow, and you force air up your nose, up the eustachian tube to kind of pop your eardrum back out. So they've also got eustachian tube dysfunction, so we've recommended some over-the-counter nasal decongestants, and if their symptoms continue, they're going to contact us. Just going to vacuum some residual oil here, and everything else we're going to leave. It's nothing. I'm not in the business of causing trauma to my patients, so it's just a bit of staining there. That's fine. The eardrum's fully visible, and that will all slowly migrate out of the ear now. And I hope you enjoyed that video, guys. Do keep well, and speak soon. Thank you. Bye.